Okay. Hi, we're so glad you joined us. My name is Jenna Billiter, and I am the regional strategist working in Virginia for Best Friends Animal Society. And I am also a member of the Virginia Federation of Humane Societies board. And we're really excited today to have Dr. Erin with us to talk about making your shelter healthy. I will turn it over to you, Dr. Erin, to get started.
All right, thank you. So let me share my screen. There we go. I am Dr. Erin Katribe. I am a veterinarian with Best Friends. I oversee our shelter medicine team, and we do consultations across the country. And so I will also just put in a quick plug for any topics that we don't get to today. I'll have some contact information at the end, and so feel free to reach out to our team for questions that you didn't get answered today, or for anything else shelter medicine, disease, population management related that you all need help with. Today, we're here to talk about managing infectious disease in shelters. We all know that infectious disease can be life-threatening, and even for diseases that don't usually lead to death, things like ringworm, for shelters that may not have the resources to treat those in-house, they can be life-threatening. There are, however, steps that we can take to reduce disease in the shelter and reduce unnecessary euthanasia. And that's what we're here to talk about today, right? Infectious disease prevention is at the heart of life saving. And that is, of course, what we are all in this for. So this is my outline for today. We'll talk briefly about disease transmission. We'll talk about what these big buckets of strategies to prevent disease are. And I will very, very briefly touch on some of the common diseases that we see in shelters. I have packed in the content, and so I'm sure there will be questions that we don't get to. Feel free to reach out via the contact information I'll have at the end. And do drop things in the chat kind of as we go for any of you attending live. All right, disease transmission basics. So one of the things that we find in our work with shelters is that shelter staff often don't, we know that these diseases exist, but we don't understand the basics of how diseases are transmitted. And so I offer to you a little sort of primer on how diseases are transmitted and some key points and definitions. One thing I'll also throw out for all of you attending, a lot of this content we do have available in different formats, and I'll share the links for that at the end as well. And so we have both longer form content as well as short staff training videos that cover a lot of this stuff. And so if you're interested in using this to train your shelter staff, we have resources for that too. So let's start with just some key points and definitions. You'll hear me say the word pathogen. And a pathogen, the definition of that, it's just a virus, bacteria, fungus, or parasite that causes disease. And so it's this umbrella term. And so again, you'll hear me say that to mean any of these things. Pathogens typically are microscopic in most cases, meaning we cannot see them with the naked eye. And so they're essentially invisible in most cases. And so that's going to be really important because we can't see those pathogens in animals or on surfaces or on equipment. And so that's going to be, again, important as we think about how diseases are transmitted. Incubation period is defined as the number of days from when an animal is exposed to a particular pathogen to when we start to see clinical signs. And so that can be really short, or sometimes it can be really long, like days or even weeks in some situations. And so that's also going to be important because animals sometimes start to be contagious when they're still in that incubation period, meaning they look healthy outwardly, but they can still be contagious. So health appearing animals can be contagious. And then finally, some pathogens are hardy in the environment. And so we likely think of pathogens like parvo, where we know it's hard to kill in the environment. It can last for a really long time in the environment, even after the contagious animal is gone. And so in conjunction with this idea that many of these pathogens are microscopic, what that means is I can touch a healthy appearing puppy, maybe hug it next to my body. It touches my body. And even though it looks healthy today, if it's in its late incubation period for parvo, it can actually still be shedding parvo. I can't see those parvovirus particles. And so I've hugged and touched this puppy. And so now the front of my scrub top is contaminated with parvo. And I put this puppy away or put it back in its kennel. And then I go and I touch a healthy puppy. I've now been the transmission, the fomite, that we'll talk about what that word means, but I've been the one that's now transmitted parvo from this healthy appearing puppy to the that is contagious to this actually healthy puppy, and now he's going to potentially get parvo. Okay, so let's dive in a little bit more. So how are diseases transmitted? Direct contact, right? So the puppy that's shedding parvo comes into direct contact with another puppy, right? That one makes sense. We're all familiar with that one. For some of our pathogens, they can be sneezed or coughed in droplets, and so that can be up to 4 to 6 feet. Other respiratory pathogens in dogs can be transmitted via airborne or aerosolization. That means when dogs cough or bark, they can transmit their respiratory disease up to 20 feet. So cats are not good at this, but dogs are. And so when I think about canine respiratory pathogens, I think about up to 20 feet. Fecal oral. So for a lot of our GI pathogens, so parvo, panleukopenia, they're shed in the feces, and then when another animal sort of comes into contact with that feces via the nasal cavity or orally, that's how those diseases are transmitted. And then fomites. And so what are fomites? Fomites are just any inanimate object or even us that transmits, like physically transmits those pathogens. And so that can be things like cleaning equipment, can be food and water dishes, and it can be people. If I am hugging animals close to my body or kissing animals, right? Your face even can be a fomite. And so you can see in this picture, this veterinarian is holding this puppy with gloves. And so it's great that she's using gloves to handle this puppy. But what's not protected is her face or the front of her shirt. And so if this healthy appearing puppy were shedding parvo, then now her face and the front of her top is contaminated. And so the next animal that she touches, she could potentially transmit that disease. Mechanisms of transmission are different for different diseases. Many of them are common across diseases, but we'll talk about when we talk about specific diseases what applies. Okay, so let's look at fomites in a little more detail. And so I have here a video. So this was we set this up with some stuffed animals, and I'll talk through kind of what the common shelter scenario is here. So imagine these are cats that are waiting in a holding area, and Megan, the technician here, she's collecting them to move them to the surgery suite for surgery. And so she picks up the orange tabby. She introduces herself, pets the cat, holds the cat next to her body, which is great for reducing stress. She puts that cat in the kennel, and she's going to take that cat to our surgery area to have space surgery today. What is not shown in the video is that this cat was, we had, before we did the video, put some of this glow germ, this substance that glows under the black light, we put some of that on the orange tabby. And when we examine Megan under the black light, you can see that now she's contaminated. And so if we pretend that instead of glow germ, this were panleukopenia, Megan was contaminated with panleukopenia from petting that cat. And what wasn't just her hands, it was also her shirt top from where she held that cat close to her body, right? So you can even see that here. And so now Megan comes back, and so she's going to collect the gray tabby for surgery. Same thing, she introduces herself. She holds the gray tabby next to her body. And so we can imagine that this gray tabby was healthy. So same thing, collects that cat, puts it in the crate, takes it off to surgery. But we know Megan got contaminated from that orange tabby. And now when we look at the gray tabby, the second cat, and we look at the gray tabby under the black light, we can see that if that were Panleuk, we would have transmitted Panleuk to that gray tabby. So on that kitty's face, as well as on that kitty's body. And we set this up. In order to get the pictures under the black light, we went into the storage closet, and this was accidental, but we noticed as we had the lights off and we're using the black light that the door handle was also contaminated, right? So that door handle is also a fomite. So Megan's hands, Megan's shirt top, the door handle, these are all fomites in this situation. And had this been actual Panleuk, right, we would have transmitted this disease from the one cat to the second healthy cat. We have another sort of scenario that we set up. And so imagine that this is a dog, say, that was clinically normal appearing, but was actually shedding, for example, distemper. So still in that incubation period, not showing clinical signs, but actually contagious for distemper. And so Stephanie, say she's walking through the shelters, encounters this dog and pets this dog in the hallway, moves on to the rest of her job duties. And so Stephanie is, taking care of her cleaning tasks. She Unbeknownst to her, though, right, she became contaminated with distemper. And so she's performing that. So now we see her hand was contaminated. And that's what that broom handle looked like. And so that broom handle in this situation is a fomite. And so the next person that touches that broom handle is then going to become contaminated with distemper. And if they encounter the next dog that they come into contact with, could potentially spread that disease. And so I love using blow germ to demonstrate like how fomite transmission happens, because most of these pathogens are microscopic. We can't see them. But that contamination and that fomite transmission can happen across the shelter. And this fomite transmission is going to be important for almost all of the diseases that we care about in shelters. We'll keep coming back to this specifically, but keep these images in mind as you think about transmission of disease in your shelter. And this idea that healthy appearing animals can actually be contagious. Okay, with that in mind, what are our strategies for preventing disease? And so when I think about disease prevention, I put them into these big three buckets of strategies. The first one is going to be preventing that physical transmission. And when I think about this, it's about mechanical barriers. So that pathogen cannot get from one animal to the next, right? So preventing that direct animal to animal contact, or preventing that indirect contact, that fomite transmission. And so for an example, like you saw in all those videos or photos with the glow germ, just wearing gloves or wearing physical barriers like gowns. Next bucket is going to be enhancing the immune system to better fight off infection. Essentially, in the shelter world, this means vaccines, which we'll dig into in a little bit more detail, and then reducing the number of potential exposure points. And so we'll talk about this in more detail, but really what I'm looking at is trying to reduce the potential fomite transmission, or to reduce animal to animal contact by changing the way that we move animals through our shelter systems. All right, when we think about disease, who is most at risk? And I think about two categories of animals that are going to be your highest risk animals in the shelter setting. The first one is going to be young animals, because they have underdeveloped immune systems. And because even for the diseases for which we have vaccines, we don't always know when our vaccines kick in these animals, even if we're vaccinating them on a shelter schedule and vaccinating frequently. Our new intakes are also at risk. And that is because we don't know what their vaccine status is. And we also don't know if they've had recent disease exposure. So again, with animals that can still potentially be contagious and not showing clinical signs, but in that incubation period, if a dog comes into the shelter that was exposed to distemper yesterday, today, not showing any signs, and is going to probably become contagious within about a week or so. However, that dog is still going to look healthy until a few days after that. And so again, when I think about animals at risk for contracting disease, as well as animals at risk for spreading disease in the shelter, these are the two categories of animals that I think about. Well, gosh, we have vaccines for things like parvo and distemper. But what does the research say about the percentage of dogs that are not protected at the time of intake to the shelter? And we do have some studies that we can look to. When it comes to parvo, 78% of puppies are unprotected the day that they come into the shelter. That means if those puppies are exposed to parvo shortly after that intake, that 78% of them are going to become infected. What about distemper? 88% of puppies are unprotected against distemper the day they come into the shelter, but even adult dogs, almost 2/3 of adult dogs are unprotected. So far, well over half are unprotected the day they come into the shelter. And so again, just to reiterate, like our young animals, our puppies and our kittens, as well as our new intakes, are going to be the most at risk for contracting infectious disease or being infected. All right, let's talk about vaccination. So this is one of the most important strategies for preventing infectious disease in our shelters. We don't have vaccines for all of our diseases, but for the ones for which we do have vaccines for, this is going to be a key strategy. A couple of things to note. This is different for different diseases. We may get complete protection once our vaccines have taken full effect. What that means is that once the vaccines have had a chance to kick in and the animal has responded, and animals that are going to respond, if exposed to this disease, they will not become infected. So that's complete protection. For parvo, pan-loop, distemper, once an animal has responded, and we'll talk about the factors that play into that, but once they've responded, if exposed, they will not become infected at all. Versus partial protection. So when I think about our canine respiratory diseases, with the exception of distemper, so kennel cough, essentially, even if an animal has been vaccinated and fully responded, that vaccine is not going to prevent infection It'll just reduce clinical signs and it'll reduce shedding. And so again, this is different for different diseases, but it's important to know which ones apply to which diseases. For our vaccines, once we give them, if an animal responds, we get some protection within hours if we're using the correct vaccines, but it is not going to be the full effect. The full effect takes a lot longer. However, that initial partial protection or some protection that we get rapidly uh, can be helpful in reducing the severity of signs and can reduce the spread of disease in the shelter. And so that is why it is crucial that we vaccinate immediately upon intake. And I mean, like within the first couple of hours that an animal lands in our shelter, certainly not hours and hours and hours, and certainly not days later, right? So we want to vaccinate as close to intake as possible, even before intake, if that's possible. We also need to make sure that we're giving timely additional doses. We'll talk about a shelter vaccination schedule, but for some of the diseases, full protection may take weeks and it may take second doses to get that full protection. Whenever we have the option, we want to choose modified live vaccines. We want to give modified live vaccines because they stimulate a stronger immune response and they do it faster than alternative types of vaccines. And so if we have the option, we want to choose a modified live vaccine. We want to vaccinate according to our shelter schedule. And we want to make sure that we're storing and handling our vaccines appropriately. If we're not handling them and not storing them as directed, then they can lose efficacy. And we want to make sure we're using our shelter softwares in order to make sure that we're giving those additional doses in a timely manner. Okay, so what are shelter vaccine guidelines? DHPP for dogs and FERCP for cats. We're going to start by 4 weeks of age. We've actually recommended for puppies and kittens that are remaining in a high-risk shelter environment that we vaccinate even earlier. In fact, vaccinate on day 1, so essentially vaccinating at birth if there is meaningful risk. We keep vaccinating our puppies and kittens every 2 to 3 weeks until they reach 18 to 20 weeks of age. And even for adults that come into the shelter, this is different from a home setting or private practice recommendations, but we do give adults a second dose of the DHPP or FERCP. For dogs, we recommend an intranasal or oral Bordetella parainfluenza, and we give that at intake by 4 weeks of age, even earlier though, now if those animals are staying in the shelter. And then of course there's rabies. And so rabies, depending on what is required legally, it's at 3 to 4 months of age. Vaccines that we don't actually recommend in the shelter. So chlamydia for cats. So if you have chosen an FERCP that includes chlamydia, you don't need that. Even in outbreak scenarios, we typically actually don't recommend canine influenza. Happy to talk more about that. And then leptospirosis. Typically animals in the shelter are not at meaningful risk of this disease. And so this is not usually one that we actually do in a shelter setting. Vaccinating young animals. So keep in mind, vaccinating young animals can be a little bit tricky. Animals that when they're born, puppies and kittens when they're born, if mom was protected from a particular disease, they will get some maternal antibodies from mom. If mom was protected, mom may not have been protected, and then that puppy or kitten isn't going to get anything. But if she was, they'll get some maternal antibodies that may provide some early protection. The challenge, though, is those maternal antibodies will also interfere with vaccination. Those maternal antibodies decrease with time, but when that happens is unpredictable and it's variable even by individual. So even puppies and kittens in the same litter can get a variable length of protection from mom. The challenge here is that while they have a sufficient level of those maternal antibodies, they're protected from that disease, but our vaccines are ineffective to provide that long-lasting protection. But again, we never know when those maternal antibodies go away. What we do know for all puppies and kittens, the latest they go away is by 16 weeks of age. And so any vaccines that we give leading up to 16 weeks of age, they may be effective at giving that puppy or kitten long-lasting protection, but they may not be because they were inactivated by that maternal antibody. That maternal antibody that's going to go away. I hear this often in shelters. This 10-week-old puppy, he's had 3 vaccines, so he's protected. We don't need to wear gloves. We don't need to take precautions anymore. And here's the thing. The number of vaccines doesn't matter. This puppy is 10 weeks old, and so maybe some of these 3 vaccines that we've given, maybe those are effective, but maybe they're not. Maybe this puppy had maternal antibodies that were protecting him and also made those vaccines ineffective. And today, those maternal antibodies have gone away. And so the reality is, based on his age, we don't know for sure that this puppy is protected. So the reality is we cannot consider our puppies and kittens protected until they've had 2 vaccines given when they're 16 weeks of age or older. So in practicality, this means they're at least 18 or more weeks of age. The number of vaccines does not matter. We do not know for sure that this puppy or kitten is protected until they reach that 18 to 20 weeks of age and have had at least 2 vaccines, right? And so it doesn't matter that they've had 6 vaccines already, right? If we start vaccination when they're really young, if we're doing, vaccination essentially at birth, this puppy or kitten will have had a ton of vaccines by the time they reach 20 weeks of age. But until that point, we don't know for sure that they're protected. Okay, so who gets vaccinated in the shelter setting? So first, on the left-hand side, I have, say these are, 4 to 6 weeks old puppy or kittens. Do they get vaccinated on intakes to the shelter? And the answer is hands down, yes. These puppies or kittens, if they're 4 weeks of age or older, in no matter the scenario, they get vaccinated. What about nursing moms? What about pregnant moms? They too get vaccinated. I'm happy to dive in more to the specifics of this. Sometimes this is a question that comes up, but we know there's a very real risk of panleukopenia and parvo, and even in those adult animals potentially, and the risk to fetuses or to nursing puppies or kittens. There's actually not the risk that sometimes there's a myth or misperception around what that actual risk is. Again, happy to dive more into that, so reach out. But the short answer is nursing moms, pregnant moms, even ones that are going to go to term, we should vaccinate them in the shelter setting. What about animals showing signs of infectious disease or that are a little bit sick in the shelter? And so I have a picture of a puppy and a kitten, both with some respiratory disease. And the answer in the shelter, they too, yes, they get vaccinated. The only risk here with vaccination is that if their immune system is busy fighting off some other illness, they may not respond as well as we'd like them to. And so maybe we revaccinate them for a little bit longer, depending on the situation. But even if they only partially respond, or it's a suboptimal response, if I get any protection from parvo and panleuk and distemper with their intake vaccine, I want that, right? I would hate for them to get over their upper respiratory infection and then succumb to another infectious disease. And so the short answer is they also get vaccinated. And then, as I've discussed, our recommendation these days is to actually vaccinate young puppies and kittens, so neonatal puppies and kittens, if they are at meaningful risk of getting infected. For me, this means, are they remaining in the shelter? We can have a conversation amongst our shelter team. If they're going directly into foster care, perhaps that's not something that we decide to do. And so this needs to be a case-by-case discussion, but I will share with you at Best Friends, even for puppies and kittens going into foster care, we are still vaccinating on day 1. So essentially, regardless of age, the day they come into our program, they are getting vaccinated. Again, conversation that you need to have with your shelter team. And so the short answer to who gets vaccinated, essentially it's everyone. Even if you've decided you're sending your neonates into foster care, maybe it's not them, but it is everybody else. Okay, storage and handling. We need to keep our vaccines refrigerated. And while we love these little college dorm fridges because they're so convenient, we can put them in convenient places like in our intake area in the shelter. We have likely all experienced that these either freeze things or they don't maintain temperature because they are so small. And so unfortunately, we don't recommend those college dorm fridges. If you need a smaller fridge, then you can get medical grade fridges that are smaller to put in those areas, so it's convenient. No matter what, we want to monitor that temperature though, and so you can buy thermometers that will track the temperature extremes and even alert you via an app. And so I do recommend that for any refrigerator that we're using to store vaccines. If we're going out into the shelter in order to administer, for example, additional doses, let's make sure that we put those vaccines in a cooler, and we're also making sure that they're not getting frozen. For any vaccines for which we have to mix them, we want to mix immediately before administering. So once we mix those vaccines up, they potentially can lose efficacy. Now, they stay good for anywhere from 30 minutes to an hour, but if I open a fridge and see a bunch of mixed up vaccines, I don't know if they were mixed up 15 minutes ago or if they were mixed up yesterday. And so the reality is the only way to know for sure is to mix it up right before administering. And so that is ultimately what I recommend. Here are some pictures of vaccines in a shelter that we visited. And so you can see inside the vaccine tray, that condensation, and you can see that condensation on the back of the fridge. This is a red flag for me that this refrigerator is not maintaining temperature. So that happens when that warm air comes into contact with these cooler surfaces. And so this means, like I said, this is a big red flag that this refrigerator is not maintaining temperature appropriately and these vaccines are not being stored appropriately. All right, let's move on to sanitation. When I talk about sanitation, I think of this as 4 steps. Step 1 is removing the debris. That is removing the food, removing the poop, removing the obvious debris in a kennel. Next is what we recommend now is a degreasing step. Some of the pathogens that we worry about in shelters can actually live in puddles. They can live even in the presence of some of our disinfecting agents if they are in what we call a biofilm. This is basically like a slimy protective barrier. And so we have to degrease using a detergent step, using even dish soap, right? But we need this separate degreasing step to break down those biofilms before we then follow with disinfection. With disinfection, this is applying our disinfectant agent at the right dilution and for the full contact time that's required to get at the pathogens that we care about. And then a drying step, because wet environments can favor pathogen survival. And disinfectants can be damaging to tissues, right? So we don't want, paws stepping into puddles that have potential disinfectant still in them. We want to make sure that our disinfectants are diluted appropriately at the dilution that we need in order to achieve disinfection. And so eyeballing it, just pouring a little bit of disinfectant into the bottle and then filling with water is not adequate. And so we can get not commercial dilution systems, or we can get like this example of a hose attachment that actually lets us set that specific dilution. And what's really great if you're using rescue is you can get these precise indicator strips that test the concentration of the rescue. This is what the little side of the canister looks like. So there are little strips that turn color. And so you can see if we're diluting our rescue when we want a 1:16 dilution, we can verify that strip is turning purple or blue for a 1:32 dilution. Those are the common dilutions we use in shelters. And so here's an example of a strip. And so you can see that matches the 1:32. And then this was a strip. This was actually a real spray bottle of rescue that I tested at a shelter. And this spray bottle was actually used to disinfect a kennel that had a parvo-exposed puppy in it. So puppy potentially shedding parvo in that incubation period. And this was the spray bottle that was used. It tested this. And so you can see this is not any of the appropriate dilutions, any of the colors on those precise strips. And so this spray bottle of rescue, not effective, not going to be reliably effective at killing parvo. And so we did not achieve disinfection, including in this particular situation, a high risk animal, right? And so if this puppy were shedding parvo and we had cleaned the kennel using this bottle of rescue and then put a at-risk vulnerable puppy in that kennel afterwards, then potentially it would have contracted parvo. This is something I encounter in shelters. When we have known infectious disease, we'll do things like must clean the area consecutive times in order to be sure that we've disinfected. And I have a question mark here. And so the reality is, if we have contamination with a pathogen, putting a new animal in that kennel today or 6 months down the road doesn't matter if we're dealing with hardy pathogens. What matters is that we have disinfected fully, right? Because these pathogens are going to live for a really long time. So if we have a known contamination, we don't necessarily need to wait a set amount of time, but what we do need to do is ensure we're disinfecting appropriately. Do we need to do it several times? Like, for example, in this sign, 3 consecutive times before the sign or before we can use that kennel for a new animal? And the short answer is no, as long as the product is making contact time with all the cracks and crevices in that kennel, right? So one good disinfection is enough. Now, we all have experienced kennels that maybe are suboptimal, that have cracks and crevices. And so oftentimes we will do things like deep clean multiple times to ensure that we're making contact with every single little crack and crevice in our suboptimal kennels. And so that is the reason for sometimes disinfecting multiple times. But again, the key here, we don't have to wait a set amount of time. It's about disinfection. So it's about using the right product at the right dilution and for the right contact time. Common equipment. So equipment can be foam mites. This microchip scanner that you can see here that was sprayed down with rescue. This was a microchip scanner that went into a ringworm isolation ward to scan some cats on intake and then came back out. And this was the spray that the staff had used to disinfect it. And so they sprayed this and they let it sit. But is this adequate? And so you can see the rescue is only making contact with what? about a third of that microchip scanner. And so if the rest of it had been contaminated with ringworm, not effective. Same thing with the scale, right? Sprayed down, but that rescue is not making contact with the bulk of that scale. And so that is not going to be effective. What can we do instead? And so I offer you this example. We can use physical barriers, right? If we don't have time to disinfect in between everything, we can use physical barriers to prevent that disease transmission. So just a piece of newspaper or a puppy pad. And we don't want our common equipment to be fomites in our shelter scenarios. I have some more pictures of from shelters, just fomites or places that disease could be living. So in the little cracks and crevices, you can see these were some kittens that had upper respiratory disease. And I call this out because you can see on the glass on the back, right? This is a potential place that pathogens could be living in those films, in that discharge that's on the windows. Okay, rescue wipes. So this is something I also run into in shelters. Like we want to be efficient, right? And we have these rescue wipes that say virucidal 1 minute, unless otherwise noted. And if you go and you actually read about that asterisk, canine parvovirus takes 5 minutes. And so even rescue wipes still need 5 minutes of wet contact time. And that's really, really, really hard to achieve with rescue wipes. And so while we love to use these in shelters, in fact, they are not effective at disinfecting against these hardier pathogens like parvovirus, like panleukopenia, like ringworm, because they are not remaining wet for that appropriate amount of contact time. All right, as we continue this conversation, if you're on live, put in the chat, what disinfectant products are you using in your shelters? I want to know. And I'm gonna keep moving just in the interest of time, but do put that in the chat, and then let's talk a little bit more about some of the products that are available. If you haven't seen it, the ASPCA has this fantastic resource that goes into various disinfectants and their efficacy against different sorts of pathogens. And what I'll call out to you is this top row that asks if they're effective against non-envelope viruses. And so in the shelter setting, non-envelope viruses are things like parvo, panleuk, and calicivirus. Those are the big ones that we care about. And what I will call out to you is that quaternary ammonium compounds, according to independent research, are not effective against these hardier pathogens in the shelter environment, despite label claims. What is effective against all of the bugs that we care about, and is great because depending on the dilution we're using, we can use a shorter contact time, is going to be accelerated hydrogen peroxide compounds, essentially rescue. A little bit more about quats. So how do we know if what we're dealing with is a quat? And it's, we look at the label, and so you can see the active ingredients are going to have something that has ammonium in the name. And so that's how you know if it's a quat. And even though these compounds are named things like parvosol, or it may say on the barrel, effective against canine parvovirus, independent research done in shelters has found that these are not reliably effective. And so if your disinfectant that you're using is a quaternary ammonium compound, we need to recognize these are not effective against these hardier viruses like parvo and panleuk. They are effective against some pathogens that we may care about, but they are not effective against these hardier bugs. And so that's going to be really important if these are pathogens that you're facing in your shelter. All right, sanitation, a little bit more, spot cleaning. If an animal is remaining in their same kennel, for our healthy populations, it is appropriate to not pull everything out and deep clean the entire kennel every single day. We use spot cleaning instead, and that is helpful because it reduces stress. And we know that stress can lead to a suppression of the immune system and can increase the risk of infectious disease in shelter animals. We can facilitate spot cleaning by using things like portals or double compartment kennels in both our cats and our dogs. And the ASPCA has some great resources on actually how to do spot cleaning. But so we do recommend this for animals that are staying in that same kennel. All right, next on the list of strategies to prevent transmission. So we're still thinking about preventing physical transmission. And so this is going to be biosecurity. And so this is preventing ourselves from being the fomites that transmit the disease. This is hand hygiene, so washing our hands and using personal protective equipment. So gloves, Maybe it's gowns if we're doing close handling, or even if and you can see an example of this in the photo, some sort of physical barrier. And so this is my staff inducing this dog for surgery. This is a new intake to the shelter. And so while this is a healthy adult, right? And so maybe fully gowning up is not indicated in the situation. You can see my technician here. She's just put a towel over her body to prevent a lot of excessive contamination in case this dog was potentially shedding some infectious disease. We need to properly don and doff personal protective equipment so we're not contaminating ourselves when we take off or put on that equipment. And we need to make sure that we're changing that equipment in between animals. All right. What about foot baths? Are foot baths effective? And so even if this foot bath has an effective disinfectant, we need contact time, right? So unless you're standing in this foot bath for 5 to 10 minutes, that's not going to be effective at disinfecting our footwear. What about hand sanitizer? Unfortunately, hand sanitizer, not reliably effective against our hardier pathogens. And so foot baths, I don't recommend at all in a shelter. And hand sanitizer, while it may have some efficacy and may be appropriate for the public that's interacting with a small number of animals, and is at relatively low risk, for our staff that are doing lots of close handling and potentially of infected animals, and doing it all day long, hand sanitizer is not enough. We need to be wearing gloves or complete hand washing. And then I'll share with you the sign from a shelter that we visited. Must use PPE for all high-risk animals. So essentially all puppies and kittens, so all juveniles and potentially all new intakes. Or I'll share with you, in shelters that deal with a lot of infectious disease, it's some amount of PPE with every single animal. All right, what about the public? So here are a couple of signs from well-meaning shelters hoping to reduce infectious disease spread in their populations. And so these were signs advising the public not to actually touch any of the animals. And so here is where things start to get a little bit less black and white. And so while for shelter staff, we're doing the close handling of many, many of the animals, potentially of infectious animals, versus the public, who may only be interacting with one or two, right? And when I think about the number one strategy for reducing infectious disease in shelter animals, that above all else, the thing that is going to reduce disease the most is for them to not be in the shelter at all. What we know is that adopter interaction matters. And so while these signs were from well-meaning shelters hoping to reduce that spread of disease, without interaction, people are less likely to take those animals home. And so maybe for the public, we have a different set of precautions. So let me present to you. When I think about biosecurity, I think about assessing risk. I think about for that individual animal, right? Our puppies and kittens are going to be highest risk. Our new intakes are going to be highest risk. I think about population, right? Are we in the middle of an outbreak? Is this just a community that has a lot of infectious disease? And then I also think about the risk of the people. And so really this is about the public versus staff. So one example is going into a Provo isolation ward, right? Gowns, gloves, booties is required even to go into the room, right? Because this is a high risk situation and the staff that are going in here are going to be at high risk for becoming contaminated. And then when I think about the public, while I don't recommend hand sanitizer for the public, if we're just looking for a precaution for humans that are at lesser risk of transmitting disease, if we don't have the time to police them to get them to wash their hands in between every single animal they interact with, maybe hand sanitizer has a place in that situation, especially after post-pandemic. People are familiar with using things like hand sanitizer, and so we can put up signs like this and offer that to them. And so while that lesser measure isn't as good as wearing gloves, if that risk is lower for them, I'd rather them take a lesser measure that they will comply with versus actually asking them to wear gloves or to wash their hands in between every animal. And so I offer you, assess the risk of different populations and different humans in your shelters in order to decide what's appropriate. All right. Lastly, we're going to talk about animal flow. And so this falls into the bucket of reducing exposure points. And so reducing overcrowding and reducing population density as much as we can. And so we'll have this example with these dogs. So the orange dog in the middle, say this dog is infected with canine distemper. When this dog coughs, he aerosolizes his pathogen, his distemper. And so in a full shelter, he infects all of these dogs around him. So all of these dogs become infected with canine distemper. A different shelter scenario where maybe not every single run is full. And so same dog, and he coughs in this situation. And while he still infects a lot of his neighbors, not nearly as many of them. And reducing movement. If we can reduce animal movement throughout the shelter, that can reduce that potential spread, again, by reducing exposure points. And so in this situation, so same thing. So all of these dogs have become now infected with canine distemper. And then this dog moves. And when he moves and he starts coughing, he then infects these new neighbors that he has, right? And so every time an animal moves, they potentially expose a new set of neighbors. And then when that dog moves, a new set of neighbors. And so you can see, especially with our pathogens that are aerosolized, when I think about 20 feet in the shelter, that's neighbors and neighbors on either side and neighbors across the aisle, right? And so that is how disease can spread really rapidly. And every time an animal moves, there's the staff that get contaminated. And so we can have additional fomite transmission, and those dogs get exposed to new neighbors that are potentially spreading that disease. All right, length of stay. You're likely familiar with this, right? We talk about length of stay, and that's the amount of time that animals spend in the shelter. And why does length of stay matter? It is, hands down, the most important risk factor for infectious disease in shelters. This has been shown again and again with many, many different diseases. We also know longer time in the shelter means increased stress, and it suppresses the immune system. It means those animals decline behaviorally, and then of course, it means an increased cost. And the longer animals stay, that means we cannot, we have essentially decreased capacity over time in our shelters. And so what happens? Longer length of stay means that animals get sick and they have to wait on medical care, and nobody wants to take home that sick, dog or cat. And so their adoption likelihood goes down. And so they stay even longer and they get sicker, right? And the whole time this is happening, their welfare is declining. It's not great. And it means more crowding in the shelter, which then just again, around and around in this vicious cycle, right? And so the longer animals stay, the more crowded we get. And again, just we're around and around in this cycle. All right, another strategy, and inevitably, right, some disease will come in from the community and we'll get a sick animal in our population. And so what do we do when that happens? How do we keep a single sick animal from turning into an actual outbreak? And the strategies here are we need to rapidly identify that disease, and we need to isolate that animal from the rest of the population. And maybe that means isolating them in our shelter, or even better, it's isolating them in foster care. Disease recognition in the shelter setting needs to be everyone's job. Every single staff member, from frontline staff all the way up to the director of our shelter, needs to know what signs to look for infectious disease, and needs to know what to do when they identify disease in the population. What are they responsible for? Who do they tell? Are they the ones that actually move that animal? But rapidly recognizing it and pulling that animal out of general population, that is what keeps that disease isolated to that one animal instead of turning into an outbreak. Something I hear from shelters, like, what if we can't isolate? All we have is a giant room where it's like one single room in a giant warehouse. So what if we can't isolate? And here are some examples of getting creative. And so using things like bathrooms, turning them into isolation wards. Even if it's not a long-term solution, if you can hang on to those animals for just 24 hours while you're waiting to identify a foster, it could potentially be life-saving. The picture on the right is from a temporary response shelter, an emergency response shelter, and that dealt with the distemper outbreak. And so you can see we have tarping put up over some of those kennels to separate out different sections of that shelter for our healthy animals versus our exposed animals versus the actual isolated sick animals. And then some examples of isolating in foster care. And so I love, in particular for ringworm, but truly for any infectious disease, isolating in foster care, we can provide better care for those animals if we have fosters to take care of them. And ringworm is a great example because we know they're going to be isolated for such a long time. They get better socialization. They get better care if we're actually doing that in foster or even adoption. Recognizing that preventing disease starts even before intake. And so I work with many shelters where infectious disease transmission actually happens on the animal control vehicle, either through direct contact, like putting a puppy on a vehicle with a snotty dog, or the vehicle is the fomite. And so ensuring that our vehicle sanitation is appropriate. We can use managed intake and using strategies like intake diversion, postponing intake. So say somebody comes and wants to surrender a litter of puppies, can we vaccinate them today and have them go back with that home and then come back in another 2 weeks to have a second vaccine? So maybe that vaccine will have kicked in and they'll get some protection by then. And then, of course, based on history. So are there any signs of infectious disease? If we're practicing managed intake and we're having some conversation at the time of intake, then we can get some additional information there. Okay, common shelter diseases. This is not meant to be a thorough review. This is just going to highlight how some of these concepts apply and to address some misconceptions that we encounter in shelters around some of these diseases. All right, so first up we have canine infectious respiratory disease, kennel cough. So kennel cough is caused by oftentimes a combination of viruses and bacteria. Transmission, certainly dogs coming into direct contact with one another. Fomite transmission, far often though, and this is the most challenging one in the shelter environment, it's going to be these pathogens that are aerosolized up to 20 feet or sometimes even more in the shelter. And again, we think about a full shelter, and that is a dog's neighbors and their neighbors' neighbors, their neighbors across the aisle. And the key strategy to preventing spread of kennel cough in your shelters is going to be rapidly identifying it and isolating those dogs. And this is a great scenario where you can say, like, I don't have an isolation ward, but even separating off like one row of your warehouse room can still be enough to reduce that spread. Key here is going to be reducing length of stay and reducing animal movement. This is a disease where the faster we can get these dogs out, the less stressed they are and the less likely they are to actually get sick with these pathogens that they get exposed to early in their shelter stay. Canine distemper. A key point here, and I could talk for hours about distemper, but just some highlights. Critical thing to keep in mind is that distemper does not always, and far less often actually, has this classic presentation that involves neurological signs. Distemper can look just like canine infectious respiratory disease or kennel cough. And oftentimes that is exactly what it looks like and only what it looks like. Transmission, same thing. So direct aerosols can actually also be spread in the urine and feces, but classically, the most important mechanism in shelters is actually going to be fomite transmission. So it's equipment, it is us that are transmitting distemper in the shelter setting. We have some updated guidance around distemper. We used to say that it was shed for a really long time, like months and months and months. But in fact, shedding is not as long as we once thought. And so I'm happy to share some resources on our updated understanding of distemper, but it is not for that, very prolonged period that we once thought it was. And the one good thing about distemper is that it is short-lived in the environment. Our standard disinfectants in shelters are all going to be effective, and it only lives for a few hours in the environment. So the one thing, again, that we have going for us is that our routine disinfection should take care of it. I also put this picture here. These are some distemper survivors. I'll share that when I was in vet school, I was taught that, number one, I would never see distemper, and that number two, if I saw it, I might as well euthanize right off the bat because it's always going to be fatal. And that is far from the truth. We see survival rates upwards of 90% in shelters that can provide even minor treatment. And here's a great example of puppies that did survive distemper and went on to find loving homes. All right, canine parvovirus. Classically, we see vomiting and diarrhea, maybe with some blood in it, lethargy and decreased appetite. And the key thing here is, for me, any dumpy puppy, any quiet puppy, any puppy that didn't finish their bowl of food, right? That is an indication for me to run a parvo test on that puppy. A dumpy puppy is parvo until proven otherwise. So my threshold for testing is very low. And parvo is always on my mind anytime I see a quiet puppy. Key to recognize that parvo is contagious before these animals start to show clinical signs. And so the healthy looking puppy could actually be shedding parvo. Remember our fomite transmission, right? So healthy looking puppy that we touch, we can become contaminated and then transmit that onto the next animal. And so transmission of parvo is, of course, direct contact, shed in the feces, right? And then, of course, fomites. And fomites can be us. They can be those inanimate objects. They can be equipment. A fomite could be a kennel that's just not sanitized completely, right? And so keep that in mind when we're thinking about these diseases. And parvo is really hardy in the environment and can live for months in the environment around fomites. Feline panleukopenia, similar to parvo, right? Transmission is fecal or through direct contact, and also, again, fomites. It is, like parvo, very hardy in the environment. For me, my threshold for testing kittens is going to be any vomiting kitten. Very similar to parvo and puppies are these clinical signs, but kittens tend to not scarf and barf just like puppies do, right? And so any vomiting kitten is an indication for me to test, as well as any dumpy kitten. What is quite different about feline panleukopenia from parvo is that sometimes clinical signs or that the disease progresses so rapidly, we don't have time to see gastrointestinal signs. And panleukopenia is the number one cause of sudden death in shelter cats and kittens. We also see panleukopenia in adult cats. And so sudden death in any cat in the shelter setting is an indication for me to test. And you can actually use that test postmortem. Okay, feline upper respiratory disease caused by oftentimes a combination of viruses and bacteria. And this disease is a little bit different than some of the other ones. Healthy cats can carry these pathogens. And in fact, if we actually test cats on intake to the shelter, sometimes upwards of 50% of healthy cats can carry these pathogens, but they don't all have to get sick. Transmission, many of these cats are coming in already infected with one or both of the big viruses that we see commonly in shelters. If they're not already infected, though, these diseases can be transmitted via direct contact or fomites. While these are respiratory diseases, clinically, when we actually look at the research, we don't see them transmitted via droplets or via aerosolization. And so clinically, this isn't as important. It's direct contact and it's going to be fomites. So why is it that some cats get sick and some don't? And what the research tells us is that it's cats that spend a long time in the shelter. Because over 50% of these cats will come in carrying these pathogens or get exposed early in their shelter stay. The longer they stay in the shelter, the increased likelihood of getting sick. And that is because of stress. The quality of the housing. If we give cats more space, that can be protective against respiratory disease in shelter cats. If we decrease movement, again, that causes stress. And so if we spot clean, then that can reduce stress on cats and they are less likely to get upper respiratory disease in our shelters. This is the one disease for which an isolation ward is not necessarily needed, right? Actually moving those cats from their regular kennel to a respiratory isolation ward may increase stress and may actually make their disease worse. And so we actually recommend doing things like isolating in place. All right, let's talk about ringworm real quick. Transmission here is going to be direct and from the environment. Ringworm is hardy in the environment. It's one of these hardy pathogens. Rescue is still effective when we use it appropriately. We know, right? It can take weeks to fully treat. And so while we do want to isolate, foster care is such a great option for our ringworm kittens. Sanitation is going to be important. It is hardy in the environment, but the thing that I would call out, if we are dipping with lime sulfur, I know it's stinky, but it's highly effective. And environmental contamination from these cats is really, really low if we're dipping them with lime sulfur that has residual effect. And so ringworm is not a disease that we need to be afraid of in the shelter setting. And we can effectively treat these cats in shelter or in foster care. All right, as we're wrapping up, what are signs of infectious disease? What are the things we're thinking about in shelters? We're thinking about any hair loss. We're thinking about ocular discharge, nasal discharge, sneezing, coughing. We're thinking about any vomiting or diarrhea, right? And again, hair loss. As you're moving through your day, what are we thinking about? Any animal, even ones that look healthy, could be contagious. They could be shedding these invisible germs. Ask ourselves, what PPE should I be using to protect myself from contamination if this animal I'm handling is shedding infectious disease? Or what if I became contaminated unbeknownst to myself and I need to protect this animal that I'm handling from the disease that I could be contaminated with? We all know disease prevention is life-saving. And we have these really solid strategies to prevent infectious disease in our shelters. It's about biosecurity. It's about sanitation. It's about vaccinating on a shelter recommended schedule. And it's about reducing length of stay and movement. When we see disease in our shelters, keeping it contained means identifying it rapidly. And with the exception of feline respiratory disease, it's about isolating those animals. So we prevent that one case of infectious disease from turning into an actual outbreak. In the event that you are experiencing an outbreak, or if you have disease concerns, I highly recommend you reach out and ask for help. And that is what our team is here for. And so I work with the National Shelter Medicine team at Best Friends. And so you can reach out to us through this form online that QR code will take you to, or you can just feel free to email us at sheltermedicine@bestfriends.org. And if you have any questions, especially for those of you that are watching the recording, reach out to us at sheltermedicine@bestfriends.org. If you are asking questions about how to manage these specific infectious diseases in your population, we have medical protocols that you can use as templates. You don't have to recreate the wheel. And so check out this Airtable that we have of a library of medical protocols. And so you can get those samples just to use as templates there. All right, and I will leave that up. And I have not seen any questions come through in the chat, and we're just about at time. And Jenna put her information in the chat as well, but feel free to reach out to either one of us if you have any questions following this. We're happy to help troubleshoot infectious disease in your populations or any other shelter or medicine related questions.
Thank you so much, Dr. Erin. Have a great afternoon.
All right,
Thank
thanks
you.
everyone. Bye-bye.
Bye-bye.